Good afternoon, Dr. Mafolo. You're welcome to go ahead.
Good afternoon, everybody. I'm so glad to be part of this webinar. I am Dr. Tsepiso Mfolo, and I'm the Vice President of the South African Association of Pediatric Dentistry. I'm very delighted to be addressing the public today because often than not, we are addressing our colleagues, we're conducting webinars to share information, but today is quite a special day where we share our information with the public. So I promise I will not indulge in a lot of dental jargon. I will just keep it basic so that everybody understands. This is a joint webinar series with SADA and SAPD because we are promoting Children's Dental Health series for the Youth Month. So our aim as an association, South African Association of Pediatric Dentistry, our aim basically is to promote oral health and well-being of children in South Africa. And what better way to start with this part of topic? I know my title says Mom and Me, but everybody is invited to come and watch the webinar because I promise it would be informative to everybody in the public in the quest to end this oral diseases that we are facing. So without further ado, my topic is Mom and Me, the impact of maternal health on infant oral health. We get a lot of questions on our website because we have a parental portal. I will share the website at the end of my presentation. So one of the questions that we normally get from the public is, when should I start taking care of my child's mouth? I'm sure there are a lot of people who are thinking a year, 2, 3, 5 years. The answer is in pregnancy. Oral health is an integral part of general health and well-being. So starting in pregnancy, it's starting from when the mother is starting to take care of their health and looking at healthy options to eat and taking care of the baby. So what better way of starting to take care of the child's mouth while they are still in the womb? And as we know, oral health is often neglected. Somehow the mouth is often seen outside of the body, and the mouth is a very integral part of the body. So to improve oral health in children, we must improve the pregnant woman's oral health. Poor oral health during pregnancy can lead to poor health outcomes for the mother and also for the baby. If you can see on the screen here, it's pregnancy gingivitis. This is basically gum disease during pregnancy. So women experience many physiological changes when they are pregnant, and that includes also in the mouth, in the oral cavity. So during pregnancy, you'll see that the gums are prone to bleeding, and also they become red and they become inflamed. And pregnant women are more prone to these gum diseases because of these hormones, and they're also prone to having cavities. According to the Center of Disease and Control, nearly 60 to 75% of pregnant women have gum disease. We call it gingivitis. As I said, the gum becomes red, it becomes swollen, and it also becomes inflamed. If this gum disease is not treated, then the bone is also affected. And the bone, as we know, it supports the teeth, and the teeth can be lost because of that bone loss, and the gums can become infected as well. It's a very uncomfortable situation for a pregnant woman to be in. So the teeth then become loose and may eventually be extracted or taken out. Research has also been proving that periodontitis, which is that bone disease, has also been associated with poor pregnancy outcomes, including preterm birth and low birth weight. So as we can see that oral health is associated with general health. So it's important to take care of the pregnant woman's mouth in order to take care of their general health and well-being, and also the well-being of the infant. This is just an illustration. If you can see, it's healthy gums. As I said, gingivitis is that gum disease where the gums are red and they're inflamed. Pregnant women sometimes will find that when they brush their teeth, the gums bleed easily. Even when you're not pregnant, when you have this gingivitis, this is exactly what happens. The gums become red, they become inflamed, and when you brush them, they bleed. And in the worst case scenario, it's periodontitis. The bone is also affected. And if the bone is affected, therefore, the teeth become loose. Now, how is pregnancy associated with decay? Pregnant women are at risk of cavities due to changes in behavior such as eating habits. We all know that when mothers are pregnant, they've got cravings. And most of the time in this type of cravings, they crave sugars and they crave things that are not healthy, snacks that are not healthy. So early contact of these bacteria and other sugars from snacking will cause this type of dental caries if they are taken in excess. Research also proves that 1 in 4 women of childbearing age have untreated dental caries. This is a very important point because, as we know, it will affect the infant as well. I will explain later. Children of mothers who have high levels of untreated cavities or tooth loss are more than 3 times more likely to have cavities as a child. So it's important for the mothers to take care of their mouths so that they don't make the child have the likelihood of also having cavities. This is also what happens in pregnancy. We get this pregnancy tumor. It's benign, so it's non-cancerous. It's an overgrowth that mostly affects the gums in pregnant women. This tumor is caused by plaque buildup. So if you have poor oral hygiene, you don't brush twice a day, you don't use floss, you don't use your mouth rinse, you do not visit the dentist, plaque accumulates, and hormonal changes during pregnancy, we know that they exacerbate this plaque buildup. So this pregnancy tumor is often seen in the 2nd trimester, and it often disappears when the child is born. But however, if it persists or if the pregnant mother feels that there's a lot of blood because it causes a lot of bleeding in the mouth and it causes discomfort, they cannot function, they cannot eat, sometimes they can go to the dentist and just surgically remove it, but it's not such an invasive process. Effects of morning sickness on oral health. I bet you never thought that you can talk about morning sickness and oral health in the same sentence. Some pregnant women have difficulty in tolerating toothbrush or even a floss due to the gag reflex that they feel when they're pregnant. The bacteria that are normally present in the mouth are likely to cause pregnancy gingivitis or tooth decay, because if they don't brush, then there will be an accumulation of plaque and it will cause the gingivitis or the tooth decay. And sometimes this particular nausea that is experienced in morning sickness is accompanied by vomiting or regurgitation. So the stomach acids irritate the gums and soften the outer layers of the tooth enamel, allowing it to be removed easily. So when that happens, the enamel becomes very thin. And when the enamel becomes very thin, in our terms, we call it dental erosion. The enamel becomes eroded. So what I can share with you in terms of morning sickness, I know it's a foul, it's a foul feeling in the mouth. You feel like your mouth is not smelling well. You feel like you just want to brush your teeth. at the same time and want to eradicate whatever that is in the mouth. But my advice is, or the advice that has been put out is that you wait. You wait for 30 minutes before you brush the teeth. You'd rather just rinse with water, just plain water. You can just rinse with water, because when the woman vomits, then there's a lot of acid in the mouth. Then when you take the brush, it abrades the enamel, the outer part of the tooth, which is causing too much damage. You're going to erode the tooth even further. So the advice is just rinse with water. After you rinse with water, after 30 minutes, then you can brush with your toothbrush and your fluoridated toothpaste, and you can use your mouthwash. So this is what I'm talking about when I talk about dental erosion. You can see that the outer part of the tooth is worn off. Now, there are so many myths and misconceptions that are out there. This is just one of them. So there's one myth that says, gain a child, but lose a tooth. Is it a myth? Is it a fact? Or is it a fact? So this comes from the point that a woman will predictably lose a tooth during pregnancy due to the belief that the woman loses the calcium from the teeth and bones during pregnancy, because the baby in the stomach needs it to develop their own teeth and bones. So as we know that in pregnancy, I said there are hormonal changes in progesterone, the hormonal changes that cause or exacerbate the gum disease. So by virtue of that, pregnant mothers may eat more unhealthy food, leading to tooth decay, which may ultimately lead to that tooth loss if not treated early. And we talked about the acid erosion. So it erodes the enamel, and therefore you have increased risk of having dental diseases. So, you know, at times you look at what is happening when you are pregnant, and you are more prone to lose your teeth when you don't have adequate oral hygiene in the mouth. Now, what are the recommendations that I put for pregnant women? So the public needs to know you can maintain your oral health by brushing twice a day and flossing once a day. Prevention is just much better than cure, than coming and drilling and filling the teeth. So you'd rather do the prevention at home. Brush twice a day, use your floss. You can also use a mouthwash. Schedule a dental visit while you're pregnant. I know before people used to say that you can't go to the dentist when you're pregnant. You can schedule. Literature now says you can schedule your dental visits while you are pregnant, because you are preventing oral diseases from happening, or you're just trying to keep your oral cavity in good form. So you can also start eating, you can have a healthy diet, reduce sugar, lower your intake of sugary foods and beverages. You can have your, your fruits and your veggies, you can increase on those. And brushing after eating sticky or sweet foods, I will just say avoid by all means. If you have to, just put them at a minimum. Quit smoking, that's a non-negotiable. Quit smoking or using any tobacco products. In case you have hypersensitive gag reflex, you rinse with water and you brush later after 30 minutes. You may be asking now, what is the link between maternal oral health and infant oral health? I mean, how can I, as a mother, transfer a disease to my child who's an infant? So the quality of a mother's prenatal oral health has been shown to not only affect the fetal growth and development, but also her child's health through infancy, childhood, adolescence, and adulthood. So basically, what the parent does in their mouth will affect the child throughout, from infancy to adulthood, because habits are taken from the infancy to adulthood. So if mothers have poor oral health and high levels of caries-causing bacteria, the children are at a higher risk of developing dental caries. And it has been shown that mothers in particular share the bacteria in their mouth with their children. So bacteria from a mother's mouth are passed on to her child through activities like kissing the child and also sharing utensils. So basically, it means that the mother, who is often than not the primary caregiver, must make sure that the oral microflora is at a good rate. The mother must make sure that they brush twice a day. The mother must make sure that they have adequate oral hygiene, because it can be, if you've got bacteria in the mouth, that can also be transmitted to your child. It has been proven, this is scientific, by kissing or sharing utensils, because in that mouth you are harboring a lot of bacteria that you can send to your child. So I know, and I was, sometimes very guilty before I knew this information. You taste the food before you give it to the child. And what do you do when you taste the food? You are also spreading the bacteria. So just make sure that in the mouth, everything is, your oral hygiene regimen is adequate. Now, another myth, a very popular one. They are just baby teeth. They will fall out anyways. I don't need to take care of baby teeth, do I? And look at that. This is a very serious condition. It's called early childhood caries. This disease is prevalent. I'm in the public sector, so we often see that the waiting list for general anesthesia, because you can see that almost all the teeth are affected in this child's mouth, right? This child cannot eat. This child cannot chew. This child cannot talk properly. This child is probably bullied. The quality of life is really being affected. This child cannot take food and cannot grow, because how can you eat with such a mouth? So the waiting list is long in the public sector. In the private sector, yes, you can go to theater. Not everybody has got medical aid to be paying for general anesthesia. And I must tell you that this particular disease is preventable. If you see a child like this, they will miss school because they will be in pain. They cannot sleep. They will be in pain. There are abscesses there in the mouth. The mother will take off from work, or the dad will take off from work, because they have to go for multiple dental appointments. So this particular disease not only has an individual impact, but it also has a social impact. But this particular disease is preventable. And now we're talking about preventing this disease from pregnancy on. Now, there are biological, we talk about the social risk factors, what predisposes the child to be getting this type of disease. So in the biological, you talk about, the frequency and the length of feeding bedtime bottle. So often than not, the parents send their children to sleep with a bottle, and that is not acceptable, because when that bottle has contact with the teeth, it causes dental caries, it causes decay, because the sugar is in contact with the teeth and they become rotten. And time is really an important thing. If you put rooibos in a bottle, child's bottle, and you put sugar there, if you put it several times in a day, how many times are you subjecting the child to a sugary diet? So it's very important that you do not send a child to sleep with the bottle full of milk. Breast milk has natural sugars and can also cause tooth decay. So there's literature that shows that, nocturnal feeding, because it has sugars, it can cause dental caries as well. Breast milk can also cause dental decay if you just feed on demand as well. So babies who sleep with their mother and suckle repeatedly throughout the night expose their teeth to these sugars, and they can get decay. There are other, obviously, risk factors that are social. So this disease also, you can see it mostly in children from low social economic areas. The American Heart Association recommends that sugar in foods and drinks to be avoided by children under 2 years. So strictly no sugar to children under 2 years. Now I'm moving over to the babies, infant oral health. How do you take care of these babies? A baby's first dental visit, it's within 6 months of eruption of the first tooth. So sometimes the tooth will erupt around that time, or by 1 year of age. So whichever one comes first. Some children do not have teeth by the age of 1, and that's still okay. But the important part is that we establish a dental home. It's important for you to send the child to a dentist. Remember, we're doing preventive work. Send to a dentist or an oral hygiene or a dental therapist, any oral health practitioners. They will tell you about preventing these diseases, especially dental caries, which is quite prevalent in children. So even before the teeth erupt, you must just wipe the gums twice a day with a soft, clean cloth. Some people use gauze as well. So you do it in the morning and after the first feeding and right before bed. So this is sort of like establishing a habit that you need to brush the teeth. So even if you don't see those pearly whites, you brush those gums anyway. And it's soothing also for children, especially when they are teething. Once the first tooth comes in, start brushing the child twice a day. Very small rice grain. In my next slide, I'll show you amount of toothpaste. I saw this lovely program that the American Academy of Pediatrics have recommended. So it's putting structure into the nighttime routine. So they say brush, book, and bed. So basically before the child falls asleep, you brush the teeth, you read a book, and then you send them to bed at a particular time. Develop a routine time that you send the child to sleep. And this will develop a habit for the child going forward. As you can see in the picture, you can use your clean cloth dedicated to just brushing those gums, or some people like the silicone brush. You can get it at any store they sell. It's very nice. It can also be soothing, as I say, for when children are teething. Please do not put any sugary substance on the gauze. It's really not necessary. No sugary substances also on the pacifiers. It's not necessary. The less sugar, the better. Now, this is what's done in the first visit. You might be wondering, but what is Dr. Mfolo talking about? My child, before they become 1 year, they go to the dentist. Yes, we are preaching preventive dentistry now. We are done with just doing curative work. We are moving with the literature. We are moving. There's a paradigm shift to push preventive work. And my colleagues are ready and waiting to receive your children from as early as you coming when you are pregnant, and also establishing a dental home once your infant is born before they turn a year old. So this is one of my patients that I saw before they turn a year old. You can do a knee-to-knee checkup, as you can see on the upper picture. But sometimes children are quite unpredictable. They prefer a certain way to sit when they are comfortable. So here you can see mommy and the baby on the chair. We literally just getting the child acquainted to our setting. We do not want the child to come when they are in pain or when they have experienced trauma. due to sports or any other thing. So it's important that you develop a dental home before the age of 1, so that your child can be acquainted to our setting. And there are dentists that have a really special interest in children, and they know how to treat children. So it is recommended that you use a grain size. So you can see their grain size, and as the child grows a little bit older, then you can use a pea size. It's actually very, very little toothpaste on there once the teeth starts to show. So what is my take-home message? I hope I didn't, say too much, but I just wanted to, put through the important messages to the public that prevention is really very important, and it starts from pregnancy, preventing dental caries, preventing periodontal diseases. It can start with the primary caregiver, which is the mother. So oral health is a very important part of general health and well-being. So we put the mouth back into the body, because often than not, we neglect our mouth, we neglect our oral health. So let's try a little bit better, and we can be an example to our kids. The quality of a mother's prenatal oral health has been shown to affect the infant's oral health. Maintain your oral health by brushing twice a day and flossing once a day. You can even floss for a lot of times. Schedule a dental visit, even if it's during pregnancy. People find that in the second trimester, they are much more, willing to come to the dentist, because often than not, in the first trimester, sometimes they will have morning sickness. And in the last trimester, the baby has grown so much, it's difficult to be sitting on the dental chair. But we welcome pregnant women for a dental visit. Eating a healthy diet, that's very important, because what you consume, you're also consuming for the unborn baby. Quit smoking or using any tobacco products, vaping as well. Schedule your baby's first dental visit within 6 months or 1 year, whichever one comes first. It's important. Establish a dental home. Wherever you are, find a dentist, find an oral hygienist, find a dental therapist where you can send your babies there, and they can get acquainted to our setting, so that you don't end up with children that hate us or hate our profession, because they come to us when it's late, when we have to do invasive dental work. So prevention is really mandatory at this stage. In conclusion, improvement of a mother's oral health, because they are often the primary health caregivers before and after pregnancy, can lead to significant improvements in growth and development of an infant as they develop into adulthood. Here are the references I've used, as the information that I've imparted is based on scientific evidence. And when you see here, this is our website. This is the SAAPD website. We've got the parent section there as well. So we are also available on social media. You can go to Facebook, and you can also find us on Instagram. I'd just like to thank you very much for listening to me. And I hope the information that I have shared with you will make you improve your oral health for yourself and also for your children. Thank you. I will now just look if I've got questions. I don't seem to be having questions on the chat, but please reach out on our SAAPD website. I can answer questions even after this webinar series. I'm sure there are a lot of questions that the public has, because we don't talk a lot about prevention, or you don't hear a lot about prevention. So I'd like to thank SADA and the SAAPD for this platform. Thank you very much.
Thank you, Dr. Mufolo. I will close the webinar now.